Good evening, everyone. We'd like to welcome you to our collaborative webinar tonight. Our topic is restoring hormonal, body, and pelvic health during menopause, feeling your best with Rebalance PT and Philadelphia Integrative Medicine. So we're delighted to be collaborating with Hina Sheth and her synergistic team of physical therapists. We are an integrative practice and we're a hybrid practice. We're in Wayne, Pennsylvania, but you can also see us from any place in New Jersey, Pennsylvania, Delaware, and North Carolina. We'd like to acknowledge some of the things that Rebalance and Philadelphia Integrative Medicine have in common. We have both been in practice for 15 years each as a business. So Hina and I have been colleagues for some time. Our goal tonight is to support you, inspire you, answer any questions that you have, and also share a little bit more about how you can care for yourself during these times of hormonal transition. Just like to share a personal note before we move into our presentation, and that is that the opportunity is to feel and to act like and to be treated as a human these days when it's very challenging to find humanizing experiences and ways to see and treat oneself in the highest way. So how you see yourself can be related to how you are seen and how you're treated. And something that Rebalance and Philadelphia Integrative Medicine have in common is that we see you as whole. And we want to treat you uniquely in a very personalized way. Our goal tonight is to help you understand your body and to also help you to love yourself and to know yourself and to have you be treated well and have you feel that tonight. So there's only one of you, and we want to personalize your care when you see us. And we also want to acknowledge that we see you as a mind, body, and spirit. So at Philadelphia Integrative Medicine, we are a whole body approach to your integrative health. And we're talking about hormones tonight, but we really treat you from head to toe. And we'll talk about some of the conditions that we care for, including gut conditions, all types of hormonal conditions, fatigue, autoimmune illnesses, and thyroid conditions, etc. Hina will have a chance to introduce herself and to talk about her holistic musculoskeletal and pelvic health physical therapy practice. And before much ado, we'll be diving into the presentation in just a moment. After the presentation, you'll receive an invitation, a special offer to be able to make care more accessible for you. There are some great discounts that are available for webinar attendees. I want to tell you about that after you've heard from our very own Amy Nutter, our nurse practitioner, who I'll introduce in a moment, who will be presenting on behalf of Philadelphia Integrative Medicine, and also Q&A. So please accumulate your questions, begin to use the Q&A function in the bottom of your screen. If you don't see it, you can click more and ask questions there. And we'll be asking you a few questions that you'll respond to in a Zoom poll. There'll be a little multiple choice that pops up if you can help us complete that now. Just give you a little bit more time to finish that. And when you think it's time, we can share the results and then move on with our presentation. How does that look, Riddhi?
People are still sharing.
Okay. So as the host also, Riddhi, when you have a chance, can you turn on the Q&A?
Okay.
We'd love to have the Q&A open throughout the presentation so that as questions come up for you, you can add your questions there.
Mhm.
If there's any difficulty with being able to access a Q&A, if you can chat us to let us know.
Okay.
Mhm.
I'll stop the poll now. Mhm.
Um, this will. Mhm. Mhm. Okay, so that would actually be helpful for our presenters to see. Can you share that again, Riddhi? Because that will help us to see the age ranges of the people we're speaking to tonight.
Okay. I turn the option off. Mhm.
Okay. So do you happen to know?
Yes.
Thank you for responding to that. One of the reasons we're asking you questions about your age range is for us to understand if you as our participants are preparing for hormonal changes, experiencing them now, or if you're in menopause. Often that can be 55 and older, and Amy will cover some of those transition time frames.
Mhm. Yeah.
And we'll get started with the rest. As we're waiting, we'll start the presentation back up in just a moment. Mhm. Okay, very helpful. Mhm. And so if you could make sure that's a note to the panelists, it looks like many of our participants are actually under the age of 45. So really thinking about prevention mode. So that's very important for you to know, Hina, and you to know, Amy, about who you're speaking to tonight. Thank you so much. That was worth waiting for.
Yeah.
Mhm. So would like to move on and just like to share a little bit about each of our practices and a little bit about us. You'll be hearing a lot this evening from Amy Nutter, and I'll introduce her more specifically, but we wanted to also share that Hina and our team is literally an important aspect of our care is that we function as a team. So this is our group of practitioners at the clinic. And one of the things we do is meet together each day to discuss patient care. We are talking about your cases and your situation daily. We also do lots of specialty tests. You'll hear a little bit more about that so that we can understand root causes, personalize your care, and really give you some of the explanations of where symptoms come from, because sometimes it can be a thyroid cause, an adrenal cause, a sex hormone cause, and sources of inflammation and what type of inflammation can be really, really helpful. One of our purposes is to share a little bit about why you're having symptoms. Tonight we'll be talking about perimenopause and menopause, but Amy is someone we really want to get the word out so that you can get to meet her, spend time with her, and also see how wonderful a team member is that we so appreciate. We get to see her every day, and one of the things we want to do is to share her with you. So one of the things about Philadelphia Integrative Medicine is that we do not accept insurance. And so there is an investment to be part of care. And that's why we're also finding ways to find discounts for the community. You can submit for insurance reimbursement. We give you all of the paperwork to do so. We have a lot of information on our website with transparent pricing so that you can see the codes and find out how much you would be receiving from your insurer for the care that we have. And we also have a free consult, which is a chance to see how you would be helped with your particular situation. And that's a great way to meet a practitioner and to have that interaction. And you don't need to have a free consult to sign up for an appointment, but we welcome you to do that. So we have been voted Best Integrative Medicine on the main line for the last 6 years, and Dr. Patterson has gotten top doc, voted by licensed Pennsylvania physicians for this year in functional medicine. And we also hold that for integrative medicine. We are Institute for Functional Medicine certified practitioners and also board certified in integrative medicine as well as osteopathic physician. We also just wanted to highlight, and you can see our practitioners a little bit better here. Linda Sherland is a nurse practitioner who's been in practice for more than 30 years, and she is fellowship trained at the level of a physician. It's a physician fellowship for 2 years at the University of Arizona Center for Integrative Medicine, Andrew Weil Center for Integrative Medicine, and she's been a longtime practitioner at Philadelphia Integrative Medicine and really offers an incredible warm, friendly bedside manner where there is no shame and no place for shame in the patient appointment. Really creates comfort and incredible relationship connection. Dr. Patterson is our osteopathic physician, so she provides a dynamic combination of functional medicine combined with osteopathic medicine. She usually does separate appointments, but she often treats many patients in both modalities. And she's also trained as a certified hypnotherapist. So she does hypnosis and a really enhanced osteopathic experience. So you're getting hands-on care for a variety of conditions, including stress, anxiety, migraine, musculoskeletal concerns. And these are a whole body approach to addressing and equalizing and normalizing and regulating the nervous system as a whole, which has great effects on GI as well as autoimmune conditions and much more. So a little bit about Amy. She is our advanced practice integrative nurse practitioner, over 25 years of healthcare experience. She actually is the first practitioner to join Philadelphia Integrative Medicine with a existing established certification in Institute for Functional Medicine certified practitioner. So she's specializing in lots of things, including hormones. You'll hear most about hormones tonight and a little bit about how gut health connects to hormones, but she also treats gut health independent of all conditions, hormonal balance, autoimmune conditions, and as well as inflammatory bowel, Crohn's disease, ulcerative colitis, other GI conditions. So she focuses a lot on thyroid, adrenal, mood, bone health, and sleep disorders, and prioritizes what you care about and what you've come in for, as well as weight loss, bowel regularity and motility, and food sensitivities. So we're so happy to be hearing more from Amy tonight, and you'll see why in just a few minutes. And we'd like to hand it over to you for your presentation, Hina.
Perfect. So I'm Hina Sheth. Our practice is Rebalance. Rebalance
Would you
Physical
like me to
Therapy.
keep that up for you?
Yeah, that would be great.
Okay. My apologies. And just 1 second. Sorry about that, Hina.
Okay. So while Dr. Tello is bringing that up, I'll tell you a little bit more about our practice. So we're Rebalance Physical Therapy. We have 2 locations, one in Center City, Philadelphia on 16th and Walnut, and one in Narberth, Pennsylvania. We have been in practice since 2009, so 15 years. We are a group now of 5 practitioners. All of us practice a holistic approach of both orthopedic and pelvic floor physical therapy. And our biggest, biggest message is that your body works as a unit. It's not a body part. So when you are coming in, regardless if it's pelvic pain or shoulder problems or incontinence, and you'll see after I present today that everything affects each other. So our practice is really getting to the root cause, but treating you as one unit, one big person. And so this is why we're so excited to collaborate with PIM for this talk, because you'll see at the end when I present some case studies that it's really a collaborative effort sometimes. So, and to tell you a little bit more about myself, of course, and all of these things are important. I've been a practitioner for 25 years. I have 3 certifications in orthopedics, manual therapy, dry needling. I'm a pelvic floor therapist. I obviously am the owner of Rebalance, and I've been involved in NIH research studies. I've written, things in textbooks, and I've also been a writer for the pelvic health exam. I'm a community lecturer, do lots of lectures every year, and I've done a TEDx talk, which that was super fun 2 years ago. But besides all of those things, tonight I am coming to you as a fellow woman, someone who, as a mom of 3, who is a mom of 3, who has animals and stressors, and I'm going through exactly what all of you guys are going through, getting on that scale and seeing, why is that? Why am I 5 pounds heavier today than I was yesterday? Going into my closet and being like, I think I can fit into those jeans from 4 years ago. Just give me another 6 months. Not being able to enjoy wine as much as I once did. So all of these things, I know all of you are experiencing that and much more. And so I'm really coming to you to just talk to you about my experience, my patient's experience, and to kind of put it all together. So I hope this is super helpful for all of you.
And our next slide is the beginning of Amy's presentation. So we'll make that transition now. How does that sound?
Sounds great.
Thank you, Hina. It's so great to be with you tonight. Thank you for all the collaboration that you've done with us and for us to get to know you even better and also your practice. So glad to be celebrating tonight together. So without further ado, I'm going to transition over to Amy, who will do her part of the presentation. Then we'll hear from Hina. There'll be cases included, as you've heard, and then we'll transition to more of our Q&A. Here you go, Amy.
Thank you. Thank you so much. Hi, everyone. I'm Amy Nutter. As you have heard by now, I am a nurse practitioner here at PIM, and I'm so excited to be here today. And so I started going through perimenopause a few years ago. And I really took a deep dive into it, knowing functional medicine and wanting to know the root cause of what it was and natural ways that I can support myself and my health. And I became passionate about it. I just went deeper and deeper into it. And now I'd love to share it with everybody else. So perimenopause usually begins in your late 30s, and it typically lasts about 4 to 8 years. Ending in menopause, which is usually defined as 1 year without a menstrual period. It all starts at our birth or even before our birth. We are all born with all of the eggs that we will have throughout our lives. So as our numbers decline, the body produces more hormones to push out those eggs. And that causes increased hormone production and fluctuations in the levels of estrogen and progesterone, leading to symptoms like hot flashes, mood swings, and irregular periods. What are these symptoms of perimenopause? As you can know, it can be irregular periods. Some people, they get longer apart, like when some people, they get shorter, and you can be heavier or lighter. It's all very individual. One thing that most people get, though, is hot flashes. About 80% of women going through perimenopause and then menopause develop hot flashes and night sweats. Also, as our progesterone levels go down, we develop mood swings, anxiety, Sleep disturbances, often from low progesterone or from hot flashes. And as mentioned earlier, weight gain and bloating, decreased libido or sex drive. And then our estrogen also going down also affects our cognitive functioning, so brain fog and memory issues. And then leading into menopause, we can develop vaginal dryness, bone density loss, continued hot flashes, decreased metabolism, and joint pain and stiffness. So a lot going on, but I'm here to help you understand all of it and do things that we can do to minimize these symptoms and optimize our health. When I was learning more about perimenopause, I was realizing how much, when I understand it, how it's a whole body issue and how it aligns with our chakras. So our chakras, if you don't know, they're like an energetic system in our body that align with our physical, emotional, and spiritual well-being. And when I think of our root chakra, which is at our base, that's kind of like our stability. And I think of our foundational health. And then our sacral chakra, which is located right around where our uterus is. It's not just our sex hormones, it's all our hormones that are affected in perimenopause. And we'll go more into that. And then our solar plexus, which is our like core, our power, our confidence, that is our gut health. And I'll talk a lot more about that, but we are learning more and more about gut health and how important it is for overall health. And then heart chakra, cardiovascular system, they kind of go hand in hand together. And then our throat chakra is speaking your truth, letting things out, and it's also not taking in other people's issues and things. And I think of that as toxins and detoxification. And then our third eye is our inner knowing, and it correlates with cognitive health. And then our crown chakra is all knowing. And that's our nervous system. Our nervous system is all knowing. It absorbs, it takes on everything. Starting with the root chakra, our foundation of health. So we are what we eat on a cellular level. We really are. Like what you eat today in 3 to 5 days will be the mucus lining of your gut. And in 8 years, what you eat today will be part of your bones. A nutrient-dense whole foods diet is the foundation of balanced hormones, energy, and overall health. Key areas to focus on, and I'm going to repeat this over and over again, is healthy fruits and vegetables. So rich in polyphenols, those are like different colored foods trying to eat the rainbow, and fiber. Fiber helps reduce and support your gut health. And then we need protein to help balance our blood sugar and build and maintain our muscle. We need about at least 100 grams a day of protein. And a lot of people, a lot of women aren't even getting 60. And then fiber. This helps regulate our blood sugar and promotes digestive health. Most women are not getting enough of that either. We need about 25 to 35 grams of fiber a day. And as Tina mentioned, this is a really busy time in our lives. We're running here and there, working, having dogs, pets, cats, kids. And this is also the time, though, that you really need to try and focus on yourself. So I wanted to put up some easy tips to help you eat a little bit better. It's meal prepping. On Sundays, I will do ChatGPT. I love it. I tell everyone about it. To meal prep, I will ask it to give me like 5 meals that are high in protein, high in fiber, that will take me less than 10 minutes to make. And then it'll give me the recipes and it'll list out all the ingredients. And then I take that and I go to my Giant app and I put it on like grocery list, and then I'll go up and pick up. Just keeping things simple. Also cooking in batches, like making a large batch of rice or a great big batch of soup that would be perfect for lunches. And women are often hear about intermittent fasting, and a lot of the research has been done on men. Women really shouldn't be fasting more than 13 hours because that spikes our cortisol level. which I'll talk about a little bit more later. But you want to start your day with a good high protein breakfast, like a smoothie with a clean protein powder or scrambled eggs with veggies. And then also for lunch ideas, cook a little extra at dinner and pack it up when you're cleaning up dinner and have it for lunch the next day. And then also trying to keep things as simple as possible, having a themed dinner like every meatless Monday, Taco Tuesday, Crock Pot Friday, just makes planning easier. And I mentioned GPT, it's so great for meal planning. And then also a lot of people really like those healthy meal kits, just delivered right to your house. When we're thinking about our nutrition and our health, we also want to know what's going on the inside. And that's when foundational testing comes in. At PIM, we really like to have you come in and do some lab testing and do complete lab work, like a thyroid panel, and not just testing your TSH or your T4. We want to know your T3, your reverse T3, and then also your antibodies. And then blood sugar, we've talked about this one a lot too, and insulin levels, inflammatory markers, methylation markers, how your body is breaking things down, stress hormones, sex hormones, vitamin and minerals like your vitamin D, magnesium, zinc, and then a complete blood count and a comprehensive metabolic panel, which will assess how your liver is doing, how you're detoxifying, and how your kidneys are working. I love this slide. This is when we think about perimenopause, everyone's all about estrogen, progesterone. But in order to have those hormones to be optimized and working their best, you need to have all of these other ones in balance: your insulin, your adrenals, and your thyroids. As our estrogen levels go down, we become more insulin resistant, meaning that it takes more insulin to pull glucose into the cells and use it as energy. And so if we don't have enough insulin, or if we're not pulling the glucose into the cells, it's very inflammatory, and also the glucose gets stored as fat. And also cortisol levels going up, that increases the amount of blood sugar you have going on. So blood sugar balance is key for perimenopause and menopause. It's not about eating less and exercising more. I'm sure many of you know by now, I figured out myself that doesn't work. It doesn't work. It's about eating more protein, eating enough to stabilize your blood sugar and support muscle health. Eating healthy fats, like because the healthy fats slow the absorption and reduce insulin spikes. And fiber that helps maintain a steady sugar levels and support your gut health. Here's a little example of the blood sugar roller coaster. So when you eat every meal, you want to have a protein, fat, and fiber to keep your blood sugar stable. If you don't, this is what happens. You wake up, your blood sugar is low. You eat cereal, your blood sugar comes spiking up, but you haven't had any protein, fat, or fiber, so it comes crashing down. You get shaky, hangry, or you feel like you need something sweet again. You have a high carb lunch, it comes crashing back down, and that extra glucose that's not being able to be absorbed by your cells gets stored as fat, and often around the middle. And these little guys up here are your adrenal glands, and they're right above your kidneys. They produce your cortisol, stress hormones. But when your ovaries stop making estrogen, they also start working a little harder and making estrogen as well, and progesterone. This makes you a little bit less resilient in a time that we need more protection against stress, but we're less resilient against stress. And the more stress level we have, the more our blood sugar levels go up too. So they all kind of work together. And then there's our thyroid's role. Estrogen also makes us more sensitive to thyroid stimulating hormones. So as those levels go down, we are more likely to have a hypothyroidism. And also the symptoms of hypothyroidism can relate to perimenopause. So you don't know if it's good to be tested to see how your thyroid's doing. One of the advanced tests that we like to do at PIM is the Dutch test. It is a great test, and it shows you a breakdown of all of the hormones and then how you metabolize them and get them out of your body. And I'll talk a little bit about it in a case study later on, but it provides a detailed view of our estrogen, progesterone, testosterone, cortisol, and our adrenal function. And it helps us to individualize and see if you have estrogen dominance or adrenal stress and what's going on with you so that we can treat you personally. Just wanted to talk about some herbs that we like to use to help support our hormones. There's Vitex, which supports stabilizing your progesterone level as that goes down. Black cohosh, which helps a lot with hot flashes. Ashwagandha has been around for thousands of years, and it's used for adrenal and stress resilience. Siberian rhubarb is used to stabilize the fluctuations up and down. And then also we do bioidentical hormones like progesterone, estradiol, testosterone. We also test and treat with DHEA and pregnenolone, which not a lot of people know about, but it's like the grandmother of all the hormones. And a lot of people that we test for this, it is low. Now, one of my favorite topics is our gut. And it is so important to have proper gut function for all health, but especially perimenopause, because it helps regulate our estrogen levels. And it helps with absorbing our vital nutrients, and it helps to reduce inflammation. So right up here is kind of a cute little picture of a healthy gut lining and these tight junctions. So only vitamins and the minerals and the things that we need get through into our bloodstream. And down here is what we would call like a leaky gut. These wide gaps allow larger particles to get through into the bloodstream, leading to inflammation, food sensitivities, and other issues. Things to do to promote healthy gut is more fiber. We're talking about vegetables, nuts and seeds, love the flax seeds, and even resistant starches like cooked and cooled rice and cooked and cooled potatoes are very helpful for gut health. Also, probiotics are good, and we're learning more and more about probiotics, and there's specific ones that will help specific things, especially when we can do like a GI map test that I'll talk about in a little bit. And then fermented foods. Fermented foods have been around for thousands of years too, and they have helped people keep their gut microbiome more active. But with refrigeration and processed foods, we've really gotten away from it. But that's things like kombucha, sauerkraut, kimchi, yogurt, and staying hydrated, because you want to be having at least 1 to 2 bowel movements a day. You want to be drinking enough water. Usually they say around 8 to 10 glasses of water. But I like to tell people, you want your urine to be like a pale color, not completely clear, but almost. And then managing stress. A lot of research goes into just stress alone, how much that can affect your gut health and lead to leaky gut. And eliminating processed foods and sugars. Those seed oils and the no fiber, it's just very inflammatory for our system. I mentioned this before. This is the GI map. This is a stool test that we do often at PIM. And it can test for, this is our good microbiome here, as I like to say, like if our gut was a garden, the commensals are like the plants that we want to grow. And then there's the bag of bacteria, which are like the weeds. And if those are overgrown, it can lead to a lot of inflammation and dysbiosis and leaky gut. We can also test to see how well you're detoxifying and see the zonulin levels to show if you have a leaky gut, and also your immune system and how you're reacting with the secretory IgA, and the anti-gliadin, which is to test about how sensitive you are to gluten. How are you responding to it? Moving on to our heart health, our heart chakra. Estrogen affects and reduces the protection of that. When our estrogen levels go down, we have an increased risk of blood pressure, higher cholesterol, and it also changes it can help not harden our arteries a little bit. And the increased inflammation from higher blood sugar can roughen up the inside and cause plaque to stick there. Things to do to support your heart health are omega-3s. These are like fatty fish, like cold water, wild-caught salmon, flax seeds. Love flax seeds. Said that a couple times now. Or omega-3 supplements. They're very anti-inflammatory. We include those a lot in our protocols. And then exercise. Personally, when I was going through perimenopause, one day I noticed that I had just gained 15 pounds out of nowhere. And I was like, all right, I know I'm supposed to be consistent and lift weights, but I'm just going to try and join Orange Theory and work out really intense for a few months. And what happened? I got sick. I never get sick. I've been a nurse for almost 30 years now. And I got sick one thing after another after another. And I ended up testing myself and my cortisol levels had like plummeted. It was because I just was overdoing it. So exercise, you want to find something that you like to do consistently. Like walking is a great thing. But then also we want to be lifting weights and building muscle. We lose 5 pounds of muscle every decade, and our muscle supports our metabolism. It helps us become less insulin resistant, and it supports our bones and our joints and our muscles. The number one reason why people go into nursing homes is because they can't get up out of bed. And it's because you're losing muscle and you're not maintaining it. So protein and lifting heavy, you want to be lifting weights heavy enough that you can only do like 12 reps. But we'll talk much more about that. And this is a test that we like to do for monitoring our cardiac health. It's the Cleveland Heart Panel. And it's just a sample here. It can tell you what kind of inflammation you have going on, looks at specific oxidized LDL or LP(a), and then it's more targeted, so we're able to treat you again on a more personal level. Then we go to the throat chakra and toxins. There are thousands of chemicals everywhere. It's really hard to get away from them all. But it's good to try and avoid toxins like BPA and pesticides because they mimic and block our hormones. And they also can intensify symptoms. Toxins can lead to excess estrogen, causing bloating, irritation, and irritability and weight gain. And also cause burden on our liver, which detoxifies our hormones, which if that's overloaded, we're not going to be able to get rid of those out of a while either. Things you can do is eating organic, especially if you eat the skins of things. I love going to the Environmental Working Group website to know what foods they test and has the most pesticides. But it's also great to know what's going on your skin and using this cleaning products that are clean, not full of toxins as well. And then whatever you're absorbing in your body, you need to be able to get out. So that's what bowel movements, 1 to 2 a day, drinking lots of filtered water, sweating, saunas are great, infrared saunas. There's a lot of research about those, and detox baths, like doing the Epsom salt bath. It's a great way to detoxify. There's also supplements that can support detoxification, like DIM for excess estrogen, or calcium D-glucarate, or NAC, or glutathione. And then we also do targeted testing, like mycotoxin testing for mold or heavy metals. And then our third eye is our cognitive health. Our estrogen also can lead to memory lapses and brain fog and focus issues. Then our progesterone levels going down can lead to anxiety and depression and some mood swings as well. It also affects our sleep, and then insulin resistance, there we are again, causing inflammation in our brain, leading to cognitive decline. Anti-inflammatory diet is what we talked about, the whole foods, nutrient-rich diet, using the omega-3s, magnesium, B vitamins. And this is why we test. A lot of people, there's over 600 different synapses in our body of magnesium. A lot of people's levels are low. B vitamins, they give you more energy, and then other adaptogens. And something that we talk about with all our patients is stress reduction. Doing meditation, like even a guided meditation from an app like Calm or Insight Timer, that can really, just 5 to 10 minutes a day can change the brain waves. Regular exercise is so good for your mental health, and also it opens up the vascular system in your brain. And then we also support you with bioidentical hormones when needed. And last but not least is the crown chakra and our nervous system. We are all on all the time. The emails never stop. The screens are always on. And then also as our lower estrogen levels and our progesterone levels, it increases our being on, our anxiety, our mood swings, our irritability. And our autonomic nervous system, which is our fight or flight response, gets out of whack as well. I don't know if any of you have noticed that. I have. And then our sleep, which is so important. Again, meditation, breath work. I have a great video that I send to a lot of my patients about doing breath work at home. Yoga, Tai Chi, really getting centered and in your body. Also spending time in nature, grounding, walking barefoot in your yard or outside can do so much. And then building connections in community. We are so isolated and we're human beings. We're supposed to be together. So really making an effort to find your people and find joy, making a list of what brings you joy and trying to do 1 or 2 of those things a week. And then other nutritional and herbal supports like magnesium, adaptogens, and omegas and B vitamins. They're great. So I just have one case study that I wanted to talk about pretty quick. I had a patient that's 45-year-old female, came to me like many people, unexplained weight gain, increased anxiety. She also had a frozen right shoulder. She could barely move it. It was very painful. Not sleeping well, tired all the time, and her periods were every 21 days. She was concerned about hormonal imbalances and all of these things going on. We did some labs. Her blood sugar was trending on the higher side, and insulin levels were elevated as well. Cholesterol was up a little bit, and her thyroid was normal for conventional, but we at PIM and in functional medicine, we like to look at things in a tighter window, and it was kind of high on our side. Also did a Dutch test on her, and it showed that she had an elevated morning cortisol, and then it flattened out during the day. She also had poor estrogen metabolism. She had the elevated 4-OH estrogen and low progesterone and DHEA levels and low melatonin. So we have a plan and protocol for everybody, and it involves all of these different aspects. Nutrition, we really focused on getting enough protein at 100 grams a day and trying to eat, not snack in between. You're eating enough so that you're full. It's not about eating less, it's about eating high quality and enough. Eliminating processed carbs and sugar and drinking enough water. Then she was also told to do a low impact exercises that she could tolerate with her shoulder and go to physical therapy, as well as increase her strength training to 2 or 3 times a week. We did some sleep hygiene, something that we go over with a lot of our patients about consistent bedtime and keeping the room dark and different things that you can do to help sleep. We also gave her magnesium and turning off the screens. It's a hard one for a lot of people. Did the stress reduction, like the daily breath work, and she was doing the yoga once a week and then also going on walks in nature. To help with her stress resistant, we have a supplement that has combined of ashwagandha and rhodiola. I did give her some progesterone at bedtime. She had an omega-3, some DIM to help metabolize that extra estrogen and the magnesium. And the results, 12 weeks after the protocol, her anxiety was significantly improved, sleeping better, her mobility was better. She had lost 4 pounds, her labs had much improved, and she was feeling more in control and empowered with her body. That's what I have for you. I hope that was helpful, and I'm so happy to share all of this information with you.
Thank you so much, Amy. And we're really excited to hear this transition and also further discussion together. Hina, over to you for your aspect and your presentation, if you want to share with us.
Yes. Okay, hi everyone. So I get to talk to you about how menopause affects body, bones, muscle, fascia, and your pelvis. And so I kind of like to, talk a little bit about what my patients tell me. So, this is what a lot of my patients say. I wish I had my 25-year-old body back. I wish I had my sex life back, whether it's because they're having pain with sex or maybe it's because they don't feel so sexy down there, right? Incontinence, prolapses. They just don't feel like they're orgasming well anymore. And one of the other things is they're like, there's so much in my life to do. I kind of just need a manager to help me. It just helps me like manage all of this. And so when, I'm hearing a lot of these things over and over again, it's almost like, okay, what do we do? And I was hearing this before I even started hitting perimenopause. So now I'm in it with everybody else. And so, I first like to talk about when we're young, until we're about 2, you have pretty good alignment and you have pretty good movement. Babies can roll around and move around and do all sorts of things. But as soon as we start to like pass about 2 years of age, our posture actually starts to change. So I like to show this model of like what an ideal posture should look like. If we drew a line from your ear to your shoulder down to your elbow, hip, knee, and foot, it should be one straight line. And so if you look at this little guy, he's one of my friend's children that was waiting for candy. And I was like, oh my gosh, this is a great picture to take to show ideal posture. You can see he's got pretty darn good posture, except for his little ear. But you can see like kids have great posture until about 2. But as we start to go through life, cell phones, computers, we can start seeing that more than ever, our posture is changing. And this is really, really important for many reasons. As our posture starts to change, whether it's because of sports injuries, whether it's because of car accidents, uh, sports injuries, all sorts of things, having kids, C-sections, your alignment will start to change. And what happens is this ideal posture that's in green over here starts to change into red. And we start to see all sorts of aches and pains that start to arise, whether it's low back, hip, knee, foot, ankle, all the way up even into your cervical spine. And we're all interconnected. So usually around most people, around 40, you start to feel those aches and pains when you're waking up in the morning. And then what happens is when you start to hit menopause, all of those little aches and pains that you have enhances because of the decrease in estrogen and this increase in inflammation that is happening. So MSK, meaning musculoskeletal system, is prevalent in 70% of women when they start hitting this perimenopause, menopause kind of area, time in our life. It's one of the most frequently reported symptoms during menopause, and it linearly rises from pre to peri to postmenopause. And our arthralgia, which is actually just joint pain for no specific reason, is reported in 50% of the cases. And so this decline in estrogen, because of inflammation, it starts, just like Amy said, it weakens your bones, It decreases the production of new muscles. And again, more postural changes because you're starting to lose muscle that then is supporting those postures. You start to have balance issues and decreased reactivity to things that are happening in life. So this is why you start to see like you can't react to things as well. And we're going to talk a little bit more about which muscle fibers types does that. Common orthopedic changes that happen, obviously osteoporosis, joint stiffness, muscle aches from back pain, neck pain. Frozen shoulder is a common condition. It's basically inflammation of the shoulder, and it ends up causing a very stiff and very painful shoulder. And this is more prominent during menopause. Osteoarthritis, especially in your joints like the knees and the hips. And then there's like sternal pain, as well as just bone pain. And so we're going back to alignment because it's so important that we really do think about this. And I know everyone talks about alignment. Maybe for some of you, your moms may have told you, like, stand with good alignment, but really, what is it? And what does it do? So we want to look at the musculature. So when we think about poor alignment, we got to actually look at the muscle imbalances. And so if you look at these pictures, the darker red means that these muscles are tight. And the areas that are in yellow means that the muscles that are weak. And depending on a variety of different types of postures based on this photo, you can have imbalances that are different from, you know, your neighbor next door. But what ends up happening is these imbalances then further start to create musculo and fascial changes. And so what we start to see is muscles will actually start to tighten, but there's also something called fascia. Now, many of you may have heard of fascia, but what exactly is it? Fascia is basically a collagen material that starts underneath your skin, and it surrounds every single muscular cell in your body. And oops, and you can see here that, you know, this is an arm muscle that if you kind of break it all down, every single muscle fiber is surrounded by this fascia. But fascia also goes around every single organ that you have. It also goes through things like your veins and your arteries and your lymphatic systems. And so when we talk about things are interconnected in the body, a lot of it is through fascia. And so this is, I love this dissection. It's of the tongue, your breathing diaphragm goes down to the hips, all the way down to the foot. So you can, this is one fascial dissection. And so when people talk about, I don't understand, you know, I had a hip injury, but now my neck hurts. Well, this is why, is because you compensate with those injuries throughout your body. And so when you start to hit menopause, all of those things are just escalated. And so when we talk about the myofascia, it's really, really important to understand how does it affects hormones and vice versa. Well, your myofascia, remember I said it penetrates through everything. And so your lymphatics also go through the myofascia. So as you are decreasing estrogen and your myofascial areas are becoming tight, or perhaps you're not in perimenopause or even menopause yet, but let's say you've had postural changes that cause fascial tightness. You've had injuries, you've had surgeries, you've had C-sections, you've had all sorts of different, you know, surgeries potentially that may have caused scar tissue. Well, all of that will create fascial tightness. And so fascia actually plays a role in hormone regulation, in your immune function, and even your brain and nervous system function, because the lymphatics go through it. And the lymphatics are important for waste removal, your immune, you know, system, as well as hormone transport. And so if those lymphatics, which go through that myofascial system, if that myofascia is tight, then those lymphatics can't work as well as they typically would. And so this can have both an effect on hormones regulation, as well as hormones having an effect on the myofascia as well. And so as estrogen decreases, you also become stiff as you get older. Now, we talked about myofascia, but I also want to talk about trigger points. Now, trigger points are areas when you do have muscle tension and tightness, you can develop little knots in these muscles. Everyone has probably felt this. If you take your hand and you put it on your upper trapezius and you feel around, you'll probably feel some knots in there. That's kind of like basically a trigger point. And you can press on it, it hurts. But for some people, if you press on it, it can actually trigger all sorts of other symptoms. And so trigger points can exist everywhere in any muscle in the body. And so these are just some examples of trigger points, let's say in the upper trapezius, in the abdomen, in the psoas muscle. You can see here that even though the psoas muscle, which is a hip flexor muscle, it actually can give you back pain. And you have 650 muscles in the body. Or some people say you have one muscle with 650 fascial, compartments that separate those muscles. But 650 muscles. And guess what? 14 of them are inside your pelvis, which is right here. So we're going to be talking about that in a little bit. So, but first, before we talk about pelvic floor muscles, we need to talk about the menopause vaginal environment. So what really happens here is that as you're kind of transitioning into this period, your pH of the vagina starts to change. It starts to become more basic. You have this decline in estrogen, which also makes the vaginal and the bladder lining thinner. The pelvic floor muscles start to become weaker, as well as the ligaments around there. So this is just like a triple whammy going on, and you become more vulnerable to things like urinary tract infections and yeast infections and things like that. And so 50% of postmenopausal women actually have vaginal dryness, as well as pain and discomfort with intercourse. And 90% of them, I thought this was shocking, do not seek any help. And when there's lots of help. And so when we go back to these 14 muscles, which are so important for the support of your bowel, your bladder, and your sexual health, we got to think, okay, well, if all the other muscles in our body can develop trigger points and tightness and things like that, so does the pelvic floor. And here's a picture of, just a very simple diagram of the pelvic floor. You can see it kind of goes from the tailbone all the way to the pubic bone and to both sit bones. And if they have trigger points in them, you can have pain in any of these areas. And so one of the biggest things that I hear when people are like, oh, do I need to do like a lot of Kegels as I get into like peri and post menopause? And the answer is possibly, but it's not all about Kegels sometimes. Kegels might be appropriate at a certain point in time, but for some people experiencing pain, it may not be the right thing to do initially. And so I like to say pelvic floor can be a mixed bag. You can actually have, of those 14 muscles, some of them, all of them might be tight. So you can have a tight pelvic floor. You can have a weak pelvic floor where all of them are weak, but you can also have a mixed pelvic floor where you have a combination of tightness as well as weakness. And depending which ones you have, tight pelvic floor muscles, and even during menopause and postmenopause, because I see lots of women on all different age ranges, they will develop pelvic, abdominal, low back pain, genital, rectal, tailbone pain, itching pain, burning in the vulva, pain with intercourse, decreased lubrication, vaginal, rectal heaviness, urinary frequency and urgency, pain with peeing, constipation, pain with defecation, and also irritable bowel symptoms. And a mixed pelvic floor can cause a combination of both of these things. But what some people will think, oh, I have a weak pelvic floor because they have like vaginal and rectal heaviness. So they automatically think it's a prolapse. Or they have urinary incontinence with either coughing, sneezing, which is stress incontinence, or urge incontinence, where you have to like run to the bathroom, or fecal incontinence. They'll automatically think, oh, I have a weak pelvic floor and I need to do Kegels. But for some people experiencing these first three, they can actually be part of a mixed pelvic floor. And so you really do need to have the right intervention of both relaxing the pelvic floor as well as getting your pelvic floor coordinated where you know how to contract it well as relax it well. And so obviously, one of the biggest things that we see is pelvic organ prolapse. As you are, going through this time period, 50% of all women will develop a pelvic organ prolapse, and 1 out of 10 will have surgery for that pelvic organ prolapse. And the risk is, big one is age and menopause. And so for those of you who don't know what a pelvic organ prolapse is, it's basically where the rectum, the uterus, and or the bladder, or all three of them sometimes, can actually start to descend into down into and through the vagina and the rectum. And so when that happens, again, everyone thinks that, oh my gosh, I just have to do a bunch of Kegels, but sometimes that doesn't work. And we'll talk a little bit about why. And it all goes back to alignment. So when we look at ideal posture and ideal alignment, this is that plumb line that I was talking about is, you've got this straight line that goes through the body. When this happens, you get a nice intra-abdominal balance, meaning all the pressure inside the abdominals is actually better pressurized. Now, that's not what all it takes, because you also have to have good core stability, but this is the ideal posture for it. And you can see here that as your posture changes, that the diaphragm, which is a breathing muscle, and the pelvic floor, which is your support muscle at the bottom, are not in good alignment with each other. And so when that's not in good alignment with each other, you can develop weakness in the front of your pelvic floor and tightness in the back. You can start changing your breathing pattern, which makes you protrude out further into the abdomen or even down into different parts of the organ. So again, alignment is actually important to actually improve incontinence as well as pelvic organ prolapse. And so I love this picture. I actually forgot to give credit to Diane Lee, who was a mentor of mine. She is a physical therapist in Canada, amazing clinician. But she actually this is a ultrasound of the bladder. And you can see here, this is the pelvic floor muscles down at the bottom. When the pelvic floor is contracting here, you can see that there's not good symmetrical support of the bladder. But when you align the pelvis, so she's physically holding the pelvis in a good alignment, you can see when that person does a Kegel again, you can see better bladder symmetrical support. So again, more support that your whole alignment of your body, intrapelvic, extrapelvic, your whole body, it's actually important for things like incontinence and prolapse and things like that. And there's even a study in urology that was done in 2005 that showed that the position of the foot actually affects the way people recruit their pelvic floor. So for those of you who have really flat feet, possibly wearing an arch support might help your pelvic floor. So it could be as simple as that. Now, I love this. Peter Attia has blown up in this whole world. I don't agree with every single thing that he says, but I love that he says, if you want to kick ass when you're 85, then you can't be average when you're 50. So this is so important for us to know. Doesn't mean you can't improve after 50. So for those of you who are looking to kind of really be proactive about this, it's the time now. He actually talks about in your 20s is when you want to start really thinking about a lot of these. But what kids do we know in their 20s are actually thinking about this? I know my son isn't at all. All right. So general decline in general is 1 to 1.2% per year after 50. That's a general decline overall. But 2 to 4% strength loss per year after the age of 50, and 35 to 40% overall strength loss between the ages of 20 and 80. That is astonishing. And so what are we going to do to curb these musculoskeletal declines? Now, of course, there's holistic treatments such as nutrition, postural training, strength training, core stability, and pelvic floor. You can get it healthier. And the ones in the yellow are things that you can do. So we're going to talk about that. And then, of course, there's other things you can do like acupuncture and manual physical therapy, both orthopedic and pelvic. And then, of course, there's traditional treatments that you're going to incorporate, just like Dr. Nutter was talking about. You can do HRT, you could do over-the-counter medications to kind of help the musculoskeletal system, and of course, functional medicine. But let's go to what can you do? So number one, I've been talking about posture and alignment. Know where you are posturally. Get some postural awareness. And just simple things like changing the way you sit at your desk. If you don't know, what that desk position should be like, there's lots of YouTube has everything. You can literally YouTube everything. And if you want someone professional, you can actually have someone, even in a lot of these big corporate offices, they will have an ergonomic specialist come and set up your chair. You can get sit to stand desks. There's treadmills now that you can walk on. So there's all sorts of things. Simple things like even orthotics can change your overall alignment. So those simple things, but strength training is going to be one of the biggest things. Now you have two muscle groups. You have slow twitch fibers and fast twitch fibers. So slow twitch fibers are those muscles that help you posturally. They're your core stabilizing muscles. They do a lot of cardiorespiratory fitness. So think about like running, cardio type things are more of these slow twitch muscle fibers. But what depletes significantly is your fast twitch muscle fibers. So especially when you get into menopause. And so these are your power and dynamic muscles. These are the muscles that you hop with, you jump with, you squat with, you do agility training, you do things like burpees, and definitely your heavier weight strength training. So when you start to lose this, think about as you age, why do people fall so much? It's because they can't react with those fast twitch muscle fibers. And so when you can't react and you don't have that balancing to rebalance yourself and those quick responses that your body needs, you have to develop these. And so your slow twitch muscle fibers, I talked about that they're postural stabilizers, and your fast twitch are going to be those powerful, explosive ones. So when you're thinking about training, and we don't have the time today to actually go into what are going to be the best exercises to do, just know your slow twitch are going to be things like running and yoga and things like that. And your fast twitch are going to be, you got to put some weight into your strength training. So whether it's body weight, whether it's going to the gym and lifting weights, that is going to build those. And then it's also going to be agility training. And you can develop these at any point in time. It is not too late. You can do simple things like even hopping back and forth. But even if you can't hop, even doing little lateral exercises where you're really developing that reactivity, that's going to help your fast twitch muscle fibers. And then just a sample workout. Again, there's lots of different workouts. Strength training, ideally 3 to 4 times per week, is going to be really important as you're going through this stage in life. HIIT workouts, you probably want to limit it to 1 day a week, and very short, 30 seconds max of the very short HIIT kind of type workouts, and where you put in all your effort and then you have a short recovery phase. So things like Tabata HIIT workouts are good, but you don't want to do too many of them. And then also when you talk about keeping your slow twitch muscle fibers strong, it's the zone 2 cardio, which is about 2 to 3 days per week, 20 to 40 minutes, low intensity, 60 to 70% of your max heart rate. And then cool facts is strength training not only helps all those things, but there's actually studies to show that once you start strength training, it actually decreases your risk of cognitive decline and dementia. And that was a pretty significant study. And it also helps regulate your appetite regulating hormones. So you get the benefits of both. Now, fueling, it's going to be really important that you increase your protein intake. 1 to 1.2 grams of protein per kilogram of body weight, and half of those should be from plants. 15 grams of protein before you strength train, 15 grams of protein plus 30 grams before high intensity cardio, 40 grams of protein within 30 to 45 minutes of strength training, and you need to add about 0.5 grams of carbs after cardio. Now, I took this protocol between Stacy Sims, who's she's well known for all of her research in menopause, and also Peter Attia. So that's where I got that from. Now, other things that you can do because your myofascia is getting tight. Of course, you can do a lot of myofascial work at home yourself through balls, through foam rollers, through Theraguns, through yoga type stretching. Yes. And then we want to go to your pelvic floor. So what are we going to do for your pelvic floor for yourself at home? Obviously, vaginal dryness is going to be a big deal. So you want to use natural hormone-free moisturizers like coconut oil if you're very sensitive to things, vitamin E, natural balms, water-soluble lubricants. There's great ones out there, Uberlube, Slippery Stuff, Good Clean Love. They're all great. Use it or lose it. You got to use yourself down there somehow. So whether it's through self-arousal, whether it's through orgasm in any form, with a partner, with other things, sex toys and dilators, all of that's going to be important if you are not sexually active with a partner. It's okay. I think we need to tell the world it is okay to do these things. And it's going to keep the blood flowing in this region, and it's going to help get all of that blood circulating, the lymphatic circulating. It's going to keep your muscles nice and flexible so you have good blood flow, good nutrients that are getting there, especially when you are eating right as well. Okay, so what can you do for your bladder and bowel health? Really important. As you get older, a lot of people talk about how they can't sleep because they have to get up and go to the bathroom. So restrict your water about 2 hours before bed if you're noticing that you're getting up in the middle of the night, but you need to drink water. Do not stop your water intake. Reduce bladder irritants as well. There's a variety of different bladder irritants. You can Google search them, but everything from caffeine, carbonated beverages, to alcohol, to acidic things. If you are noticing that those things are irritating your bladder, you can try to start taking them out, but continue to drink water. If you have the urge to pee, you can try a few Kegels before you get into the door, or you could just do deep breathing, because deep breathing relaxes the nervous system, so it dampens your brain's feeling that it has to go to the bathroom. Or you can even try doing a few Kegels and seeing if that kind of stops your urge to pee. And then, of course, we want to avoid constipation, because if you're straining through that pelvic floor, it's going to make your prolapse worse. It's also going to make incontinence symptoms worse. So you want to definitely control your coughing. You want to eat a lot of fiber. You want to drink a lot of water, and you want to use a squatty potty. So if you don't have a squatty potty, you don't want to invest in one, just use your little garbage can. I've used that plenty of times myself. So put your feet up on a garbage can. What that does is it actually helps your rectum actually get into a straighter alignment so the bowels can come out easier. Now, pelvic floor exercises. What I mean by exercises, again, it's not all Kegels. We want to make sure that we are coordinating our pelvic floor. So we want to do Kegels if we know that a lot of our pelvic floor muscles are weak. But if we have a mixed pelvic floor, we got to do coordination. We want to breathe in and allow our pelvic floor muscles to relax, like you're initiating going to the bathroom. And when you breathe out, your pelvic floor should go to a resting state, but then you can also after that, then do a Kegel. Now, most people do Kegels incorrectly. I think it's like 50% of people, probably even more, do Kegels incorrectly. So if you feel that you're doing Kegels incorrectly, it's really important that you learn how with a pelvic floor therapist. All right. So when you try to do everything at home and it doesn't work, when do you need to see someone like myself? So orthopedic pains that don't improve, stretching, strengthening, it all hurts, stiffness despite stretching, functional limitations, and whether that's functional limitation is you can't sit because your bottom hurts, or whether it's I want to go play my sport again. Core stability program, if you feel like you have what we call alien belly, where you have a diastasis that's never been looked at, that's so important. I can't tell you how important it is to stabilize the diastases. If you have osteoporosis and you need a program because you don't know where to start, if Kegels didn't help your incontinence, or if you have a prolapse and you don't know what to do, any pelvic pain or pain with intercourse, or you just don't know what to do, that's going to be really important that you seek guidance from a physical therapist. So what are we going to do? This is what we do in our practice. I can't vouch for every practice, but this has been our philosophy here at Rebalance. We kind of look at a 3-tiered approach. We look at release, realign, reconnect. And what that means is we're going to release these muscles through a variety of techniques that we do in our clinic, from myofascial work to dry needling to cupping to active release. We are going to then align the body through joint work, lots of different techniques that we use. And then we also want to get you moving again, whether that's integrating yoga, deep core or stabilization. If you're hypomobile, we got to train that too. We're going to look at lots of things during your physical therapy evaluation from head to toe, but we want to really look at your breathing, your fascia, look to see what your core is looking like. We're going to look at scar tissue, and we definitely want to do a pelvic floor assessment and see where you are with that. There's research to support this. So there's been manual therapy and the help with pain during menopause, as well as manual pelvic floor physical therapy. I was one of the clinicians on this NIH study where we actually worked on pelvic floor and myofascia everywhere from trunk all the way down into the legs. And we saw a 59% improvement in people that had bladder pain. And so Trigger point fascial release it looks kind of like this, but there's a variety of techniques. We also do dry needling at our practice. So this is where you can use an acupuncture needle to actually break up those trigger points. You can do intrapelvic floor muscle release to actually get all of that tension and tightness out of those muscles. And then we're going to improve joint alignment through a variety of different techniques. And then we got to get you moving right, because once you get the alignment looking good, now you have a really good foundation to strengthen. And so I wanted to just take a moment to go through these case studies very quickly. So case study number 1, this is a 48-year-old female. She had complaints. Her main complaint out of all the things she has listed here that was driving her nuts was painful gums. Her gums were just hurting. She's in her past, she's had 2 vaginal births, grade 3, as well as a grade 1 tear with her first 2 kids. And then with her 3rd child, she had a C-section. She's got Hashimoto's that was diagnosed in 2018, which is actually a thyroid condition. She had a diastases after her 2nd and 3rd child, low back pain, neck pain that's been worsening, stress incontinence, rectocele with moderate constipation, moderate reflux and a hoarse voice, hot flashes, gum pain, severe dry eyes, mood swings, feelings of dread that were like a roller coaster, forgetting family names, can't drink red wine without headaches, and blood panel-wise, testosterone was elevated, TPO, which is the thyroid antibody level, was elevated, which indicates Hashimoto's, rising LDL, and rising A1C, which is your sugar over 3 months. So this is what she was told, because she went and saw all different doctors just to see what they would say. Diastases, you need surgery. Low back pain, standard PT, didn't really work, steroid injection. Hashimoto's, take some medications. Moderate reflux, take an acid blocker. Gum pain. This woman went to several periodontists, nothing wrong with the gums. So here's a tube of toothpaste for gum care. She even asked them, could this be due to perimenopause? And they're like, no, not really. Severe dry eyes. So she was told artificial tears and go on an omega, which was helpful. Forgetting family names, do some Sudoku and crossword puzzles. Can't drink red wine, just don't drink it. Elevated testosterone, don't worry about it. It's good you have a lot of testosterone. Elevated LDL and elevated A1C. It's not bad yet, and it's likely genetic. So we're not going to worry about it right now. But this person was not a standard normal person that likes to do what people tell her to do. This person was me. And so what I did was I said, well, I'm not doing any of that stuff. So what I did is over the last year, I did a diet change. I gut cleansed. I actually was fortunate to take a functional medicine course, a functional medicine course for physical therapists, because I just wanted to learn more about myself. And I'm so glad I did, because I ended up being my own patient number 1 to learn what to do with myself. So my instructor, as well as myself, we did gut cleansing to really get the dysbiosis down in my gut. I went on a low gluten diet, increased my protein intake, reduced alcohol intake load, reduced sugar and carbohydrates, and I took appropriate supplements. So Amy, Dr. Nutter talked about NAC and glutathione. I definitely added those in, as well as vitamin D, B, selenium, CoQ10, and magnesium. Diastases, I really started just getting hardcore on it. For the hot flashes and gum pain, I went on a low estrogen and progesterone supplementation. Stress incontinence, rectocele, I started doing, again, specific physical therapy targeted exercises. My low back and neck pain, standard PT wasn't working, so I actually had one of my coworkers dry needle me. And then strength training, I started 4 times a week regularly. 1 day a week I was doing yoga, and I started playing squash because my whole family plays squash now. So I got my cardio in. And then for detoxification, I started going to a dry sauna 3 to 4 times a week. And the outcome, my diastasis significantly improved. It was already getting better because I was doing this for myself, but it significantly improved over the last year. Low back pain, neck pain, it's mild to none now, and I've had this going on chronically for some time. Moderate reflux to hoarse voice, minimal to none. Hot flashes gone, mood swings, pretty much not there, although my husband would disagree. Forgetting family names, I'm still forgetting things, but it's getting better. Can't drink wine without headaches, I'm enjoying it again. And all of my blood levels as of this past Tuesday are all improved, and my Hashimoto's, as of now, has completely reversed. So I was super excited about that. Now, I was going to do a patient number 2, but I know we are getting over time. So I just wanted to check in with Dr. Tetlow. Do we have time for one more case study that would take probably 2 minutes?
I think we've got time for your second case if you want to. If you want to.
Okay. Okay. So case number 2 was a postmenopausal woman. She's a 68-year-old female bodybuilder with complaints of heaviness and prolapse. She just felt like her bottom was falling out. Our musculoskeletal evaluation revealed she had a prolapse in coordination of her pelvic floor. She had a diastases, which is that splitting of the abdomen, poor core stability using her deep core stabilizers, and she had severe bloating. Now, this is what she was told. For her prolapse, she needs a pessary, stop bodybuilding, and do lots of Kegels. And for her diastases, no one ever evaluated it. She never knew she had one. And then for severe bloating, she was put on antibiotics because they told her she had SIBO and a low FODMAP diet, but that wasn't working. And it wasn't working for her because she's a bodybuilder. So this is what we decided. So for the severe bloating, I sent her to functional medicine. I said, we really need to get this under control. And so she saw a functional medicine provider for the SIBO and the gut dysbiosis. She started reducing her protein intake because she was taking way too much. So whereas most people take less, she was taking way too much. And we started having her diet logging. And then in terms of physical therapy, we worked on her deep core stabilization and pelvic floor coordination. So this has probably been my hardest case to date because it took a lot of creativity to figure out how to get her to connect with her deep core stabilizer. So we used a bunch of different things, hyperpressives, we used 360 breathing. We did something that I kind of made up called ABC TRA training, where I was actually having her say certain words so she understood how to connect to her transverse abdominal muscles, which are your deep abdominal core stabilizers that help all of this. And then I actually spoke with her trainer because she is a bodybuilder. So we really got to get her trainer on board with this as well. And then we started layering in all of her other core muscles. So a lot of people think, hey, if I don't have good core muscle strength and I have a diastasis, I shouldn't be doing heavier weighted things. Of course you can. You just have to have the right progress of it. And so the outcome now, minimal to no bloating because she went to functional medicine. And so now all of that bloating isn't pushing against her abdomen, not allowing us to really stabilize her core. We had her do a lot of that deep core connection. She's got good coordination now. She has no prolapse heaviness, and her self-confidence and her ability to manage her stress because she has a really high stress job. Now she can manage her stress because she's doing bodybuilding, which is what she loves. And God bless her, she's 68 years old and she looks amazing. So that are my case studies. So I hope for all of you, this was really helpful to see that bringing two different holistic practices together for yourself and thinking about it in a holistic way is going to be really important if you are really looking to kind of tackle this time in our lives. So I will give it back to Dr. Tetlow.
So, Hina, if you don't mind, is there any way to change the presentation view so that it just changes the slides a little bit? Are you able to do that, or we'll just work with this from here?
Oh, is this not in presentation view?
We were just trying to let you know, no, it's not.
Oh, my goodness. I am so sorry. Was the whole view in this view?
It's just we can see the first and second, first and last.
Oh, I am
Next.
so sorry, guys. I did not realize that.
We let
So if
everyone know that we can make sure we get everyone the slides so that they can see everything. And actually, we were able to read everything and definitely follow with you.
okay, I am so sorry about that. Okay, here we go. Is that better?
We are wanting to let you know that this presentation about perimenopause and hormone balance and pelvic health is going to have a phase 2. We're going to ask you to save the date for March 2025, the 26th specifically, and we'd love you to stay tuned for a around to and the next steps on this particular topic. We'd love to hear a little bit about what you might like. So our next slide is asking you a question about what you might like to delve deeper into and hear more about, especially hearing the details of Amy's presentation and Hina's presentation. If we can go to the next slide, our question for you is, what areas would you like to more deeply address in that upcoming March 2025 presentation? If you can use the chat, let us know if you have any difficulty accessing and using the chat to express full sentences, what you'd like us to focus on. Thanks so much.